Good morning and welcome. We are here to present to you on responding to the mental and emotional impact of social isolation and loneliness on older adults during the COVID-19 pandemic. We are happy to be here today. I am Sara Richie, the Lifespan Program Manager at the University of Wisconsin-Madison Extension in our Human Development and Relationships Institute, and I'll pass it over to my partner to introduce herself.
Good morning, I'm Ruth Schrieffer, and I'm an extension educator in Human Development and Relationships here with the University of Wisconsin-Madison Division of Extension, and I'm a county-based educator in Iowa County, so I sit about an hour out of Madison. Back to you, Sara.
So just a quick overview, we are going to go over our project background and timeline, the background of social isolation and loneliness, just a little information there for you. Isolation and the COVID-19 pandemic, how we responded in extension, what our evaluation showed of our response, what we've learned, and then our next steps. So our project timeline and background, we were approached in May or mid-May of 2020 by our extension to respond to the COVID-19 pandemic by coordinating a policy systems and environment response to the human impact of COVID-19 that helps build capacity in communities to address the longer term impacts on older adults. So addressing some of the long-term mental and physical impacts of social isolation. We quickly formed our Lifespan, what we call C19 Rapid Response Team with Kristen Witzelman, myself, Ruth Schrieffer, Debbie Mullendorf, Jenna Klink, and we did have some honorable mentions. Molly Maher and Sarah Fox were graduate students that we worked with on our project. So just to highlight how quickly we moved through this project, and when we say rapid response, I feel like things in extension don't tend to happen that quickly, but we were really rapid when working on this project. We started in May of 2020. And by June, we had our first tool, which was a resource guide, and we will be going over these tools in greater detail. By July, we had our second tool developed and shared out. And and then at the end of July, we shared a partner survey. By January of 2021, we had a report written on the results of that partner survey. And then our present day, we have been continuing to evaluate, and we'll be sharing our most recent evaluation results at the end of our presentation. Before we dig into our response, I'm just going to go give a little bit of a background on social isolation and loneliness. Social isolation is a lack of social contact, someone that is socially isolated and isn't seeing a lot of people live alone or might have mobility issues and are unable to leave their house. Loneliness is a feeling of being alone, so that social hunger that tells us that we need social connection. It's an issue when we cannot go out and fill that need by interacting with others or connecting to other people. So 1 in 3 adults reported to feeling lonely, and this was pre-pandemic. So there is a difference between social isolation and loneliness. You can be socially isolated and feel lonely and not feel lonely. And you can also be surrounded by a lot of people and feel very lonely. Even though we think of them as hand in hand, or they go hand in hand, they are two different things. And older adults are at greater risk for social isolation and loneliness because they are more likely to live alone. They experience greater loss of family and friends. They are more likely to have chronic illnesses that may prevent them from gathering with others or even from leaving home. They are also more likely to have functional limitations that prevent them from interacting with others when out in public, such as a hearing loss that may make it more difficult to interact with others. And in some cases, they may even avoid that interaction altogether. Research shows that chronic social isolation and loneliness adversely impact both mental and physical health. When someone is experiencing chronic social isolation and loneliness, their body gets flooded with stress chemicals, resulting in lower immunity and higher inflammation, which can create a downstream effect causing chronic conditions. Social isolation and loneliness are associated with an increased risk of depression and anxiety. It's also associated with dementia and heart disease, stroke, and it can even be associated with premature mortality at the same level as risk factors like smoking and obesity. So in 2018, there was a study that made headlines showing that connection between social isolation and loneliness and premature mortality, which was at that same level of risk factor like smoking and obesity. There's a huge concern, and it is something that we can work to fix with different strategies that work to improve social connections. And we know that the research does show us that high quality social relationships lead to longer, healthier lives. So this is something that we want to help people with if we can. Social isolation and COVID-19 have been called the double pandemic. In 2020, in June of 2020, a report was released highlighting the need to prioritize social connections during the pandemic. So as I mentioned previously, social isolation and loneliness was a concern prior to the COVID-19 pandemic. However, when you add the stay-at-home orders and the physical distancing safety guidelines, the increase of social isolation and loneliness is leading to overlapping risks. So people with chronic health conditions became more socially isolated to protect themselves and others, which can add stress and anxiety, exacerbating existing health issues and could potentially lead to more problems for these folks down the road. Although this issue is complex and it has many different factors that play into it, it is not a problem that can be solved right away or with just any one solution. But we know that there is a clear need to prevent, reduce, and mitigate the negative outcomes related to social isolation and loneliness. Some solutions might include programs that focus on increasing social connection, like community groups or social groups, programs that help recognize and deal with the negative emotions and increase self-efficacy, or programs that help to maintain a sense of purpose and reduce anxiety. Before we get into how we responded, we wanted to know how you responded to social isolation and loneliness during the stay-at-home orders or throughout the pandemic. So if you would like to just briefly share with us in the chat, you can just share the state that you come from and maybe how you responded to that effort. And I'll just open my chat and see if anybody, we'll just give you a few seconds. Okay, Ohio, we went on walks, lots of family Zoom gatherings, yep. Great. Great, so any way that we can figure out how to get that social connection in, and there was a lot of Zoom learning happening, and I think a lot of people Zooming.
I like the Zoom happy hours.
Yeah.
Conference calling.
Oh, yes, yeah.
Newsletters, walking, FaceTiming.
Yeah, these are all great. Thank you.
Oh, the Zoom family game nights. I did hear lots about that. Oh, the tic-tac-toe on a storm door. How fun. Guess what? It's almost that weather again. Thanks everybody for sharing. When Sara was showing you the timeline of how rapidly our rapid response team pulled our resources together and developed new resources, when you think about how things usually go in extension, we were pretty amazed at how quickly we were able to determine what our deliverables could be, and then how we were able to put those together. So we did have a three-pronged approach, or a three-pronged response to the issue of older adults, specifically older adults, and then social isolation and loneliness. So Extension created and disseminated these, what we thought were easy to access resources, decision-making tools, and then best practices and lessons learned for our program response, for our communities, for our organizations, and for individuals. The goal of these efforts were to build capacity in our local communities and provide them with the tools they needed to respond and reduce the negative impacts of social isolation and loneliness on older adults and other high-risk individuals. Our survey data and continued discussion with our community partners and educators helped to shape the programming responses. And we're thinking that that's actually going to carry forward beyond the pandemic and to inform our communities on how to respond in the future if we experience another pandemic or other community or public health emergencies. So the resource guide was created with the intent to build capacity among our educators and their community partners to respond to the needs of the residents in their local communities. So that was the first product. The second product, the decision guide, was developed to help people make difficult and personal decisions about how or when to move out of quarantine and start interacting with others. Think back a year and a half and the kinds of discussions we were having then. Whether or not it's smart or safe to bring in respite care, go to doctor's appointments, send children to school or daycare. And then our third response was the partner program survey, which was an effort to collect and compile information from adult serving agencies or groups on their programming that addressed social isolation with the intention of sharing all of that information back. So the findings of the survey helped to inform others of the programming, best practices, and lessons learned. So we went over that pretty quick, but we're going to give you a little bit more information about each of these three responses. So I'll turn it over to Sara to talk about our resource guide. Oh, Sara, you're on mute.
Oh, here I am. Sorry about that. So the resource guide was the first tool that we completed, and we launched that in June of 2020. So we developed the resource guide to ensure that agencies and residents had access to basic information on where to turn for help when experiencing social isolation and loneliness during the pandemic. So the team compiled resources that were localized by our extensions, county-based educators, and then they shared those out locally with partnering organizations and other professionals in the community. The resource guide is 2 pages and includes resources such as Aging and Disability Resource Center, or what we call the ADRC, opportunities to socialize that might be available in the community, different caregiver support groups, emergency services for physical and mental health needs as well. So county educators sent the localized guide out to local partners such as the ADRC, healthcare providers, county government offices, and even some county government offices and community partners put the guide up on their website for residents to access. So the tool was designed to help Extension build and maintain partnerships throughout the pandemic and build capacity within their communities to respond to individual needs of those experiencing social isolation and loneliness during the pandemic and beyond. So we piloted the resource guide with a few local partners before we launched. Once the guide was ready for distribution, we shared a folder with our colleagues that included guidelines and email templates for local distribution. We then hosted an internal webinar in August of 2020 for our colleagues to bring awareness to our COVID-19 tools, highlighting the resource guide and requesting their assistance in localizing and sharing out the guide with local partners. We had 90 colleagues attend the webinar, and we found out through evaluation that 43% of the participants had not heard of the resource guide, indicating that our webinar was in fact needed in order to increase awareness. 91% agreed that the webinar improved their understanding of social isolation and loneliness and how it impacts individuals and communities. 91% agreed that the webinar increased their capacity to discuss social isolation and loneliness with partner organizations, individuals, and families. And then 88% agreed that the webinar increased their knowledge about where to direct local partners, organizations, individuals, and families who needed support addressing social isolation and loneliness. This resource guide was also presented to state partners just to bring awareness to our resources and to Extension.
Going off mute. So at this point, we're going to talk about the decision guide, but first I want to ask you a question. And Sarah, do we have this in a poll or are we popping it in chat? We have it in a poll. So here's your opportunity for audience interaction. What helped you personally, your family, your household, make informed decisions throughout the pandemic? Ooh, CDC guidance is already in the lead on my screen. So share with us, did you rely on Extension resources, local health department, the CDC, selected friends and family, personal beliefs or views? Oh, we're seeing lots and lots and lots of, we should have had an any other up here and let you fill in the blank. How did you make informed decisions throughout the pandemic?
So it looks like it slowed down a little. Oh, there we still have a few people.
There we go.
Share the results here pretty
Yep,
quickly.
I think you can share. We did a minute.
All right, so we'll end and then I'll share on the screen.
And
1% CDC guidance.
When I look at this, it's interesting that as educators, we were all busy writing them. Lisa, that is very funny. You are so very correct in that. As educators, I think we had the benefit of knowing about trusted resources, credible resources. And I think that's where CDC and local health departments come into play. State extension resources, so many of them were being developed, so I could see why that's on the lesser end. Interesting about this whole idea about the selected family and friends. I know we certainly had some good conversations in my extended family with who was choosing to do what, why, and when. And one size absolutely did not fit all. And then certainly our personal beliefs, views, values have to play into this. So thanks, Sarah. You can stop sharing and we will stop sharing the poll. Leave the slides up. Can I get rid of that? Okay. So the second resource that we developed was a decision guide. And we launched that in July of 2020, and it was available in both English and Spanish. The purpose of that guide was to help individuals and families think through the many elements that come together in making decisions around, we called it moving forward at that time, recognizing that decisions can be complex and very, very personal. The decision guide, and we're going to make sure you get a URL for the guide, walks users through the decision-making process, either using a worksheet or a flow chart or an online click-through tool. The guide and the tools share local, state, and national COVID-19 resources that help users find the information they need and think through the questions that they need answered in a local context, what safety measures they can take, and what personal risk or benefits there are in interacting with others in their home or in public spaces. By design, the tool does not provide a clear answer at the end, but helps the user make decisions on their own based on how they answered the questions. The decision guide document, we ended up with 97 downloads of the English worksheet, and you can see the different tools that we had shared here. 97 downloads of the English worksheet, 72 downloads of the English flow chart, 400 clicks on the Spanish version with 18 downloads, 16 downloads on the Spanish worksheet, 10 downloads of the Spanish flow chart. And our Facebook posts, we had over 300 reaches and a few clicks and a few shares. Sarah, I'll let you go to the next slide. Oh, wait, no, stay right there. Go back. So let me tell you a little bit about these tools. So the worksheet was kind of a fill in the blank tool. The flow chart was more of a if this, then that. And the third option was a click-through tool. So most people started with the narrative information and then found the tool, either the worksheet, the flow chart, or the click-through online to actually do the activity. As mentioned on a previous slide, these tools were not designed to give a direct answer, but to help lead individuals into making an informed decision that best met their needs and their situation. We made these tools, the decision guide and the tools, available to extension educators, state partners, and social media outlets, as well as on our Extension COVID website. And so then the question is, how was that decision guide used? And I already gave you some of the data on that, with the clicks, the downloads, the reach, far and wide. So I can talk next about, on the next slide, Sarah, about a specific evaluation effort. So we wanted to know if the decision guide was useful. We're extension, that's what we do. We wanted to know if it mattered in terms of behavior and in terms of knowledge. So I don't know about your states, but in Wisconsin, we still have the Wisconsin Association of Home and Community Education Association, formerly known as Extension Homemakers. And I have several clubs right here in Iowa County. So I sent the decision guide and the worksheet to my HCE members to do some evaluation. And as long as, and in addition, I did send a postage paid envelope along with my survey, because that did help to increase my responses. What we noted, and as you can see on the slide, 57% of the respondents reported that they used the guide and the worksheet to make decisions for themselves and their family, so over half. All of the respondents indicated that they had a high or very high level of awareness of COVID safety measures after using the guide, compared to about 2/3 with the same level of knowledge prior to using the guide. 92% of the respondents indicated they had a high or very high level of knowledge of where to access more COVID resources and data trends after using the guide, compared to 38% that had that same level of knowledge before use. The number of respondents that felt they had high or very high capacity to think through the risks and benefits of the situation in the decision-making process increased by 30% after using the tool. And finally, 77%, like 3/4 of the respondents, had a high or very high level of awareness of what issues to consider while making decisions about moving forward during COVID, compared to just under half of the respondents with that same level of awareness prior to using the guide. So this was a small subset, but I think the responses indicated that the tool actually absolutely met what our goal was. And Sarah, you can go to the next slide. So in terms of ongoing evaluation, we are starting, we really are. We had great news again this morning from the CDC. We're starting to see this light at the end of the tunnel. When we put this together, we didn't have a vaccine. Now we have a vaccine. As of this morning, even more of our population is eligible and will have access to vaccine if they choose, or if their families choose. But we still think there's value in our decision guide. And as we went through this process and looked at a potential revision, we did actually convene a focus group to evaluate the existing document and tools, and then talk to our focus group participants about how it can be adapted for broader use. And the focus group said, Our worksheet and flowchart were beneficial companions to the information piece. So some people like to read, but they absolutely did like the interactive, the way to engage with the information, either in the flowchart or the worksheet. They also thought our materials were logical and easy to follow. And they were constructively critical of our tool also. They really thought we could do a better job of defining our audience. Was this targeted for families and older adults? Was this designed for families with young children? So they thought we could do a better job there. Right away, check your reading level, check your reading level, check your reading level. Who are we targeting? And are there ways to describe this concept of a pandemic and decision making in a way that more people can relate to and understand? And then we're academics, so we did footnotes, but they absolutely thought we should think about embedding links within the text rather than the footnotes. With that, I'm going to turn it over to Sarah to talk about resource number 3.
So our third resource was the partner program survey. We did a statewide assessment to learn how have communities responded to social isolation and loneliness during the pandemic, and what lessons can inform community efforts going forward. So we sent a survey to local partners assessing 3 key themes. The first being what programming or initiatives they are currently offering to prevent or mitigate adverse effects of social isolation and loneliness, and the impact of these programs. 2, perceived unmet gaps or needs in their community, such as social isolation and loneliness. And 3, how they anticipate that their programming in this space will evolve over the next year. So we used a data jam approach to identify themes in this data that we collected. Stakeholders from multiple organizations joined our team during the data jam sessions, providing diverse perspectives and insights on the themes that emerged within the survey responses. The goal of the final report was to amplify programs that work to reduce or prevent social isolation, help communities improve response, and learn best practices. So we relied heavily on our extension educators and state partners to send the survey out to partners at the local level. We received responses from 90 organizations with 117 different programs. The results were disseminated in the following ways. We shared out on the North Central Region Aging Network with a special invite extended to survey participants. We had 63 participants on that webinar. Community health coordinators and aging unit / aging and disability resource center directors. There's a network of them that meet monthly. We did a presentation on one of their monthly meetings with 62 participants. And then we shared out to the public and community partners, as well as extension faculty and staff via our Lifespan website and on our Facebook page as well. So some of the key takeaways from the partner survey were that a variety of different programs were represented. Many programs focused on meeting basic needs, but they had an indirect role in preventing social isolation and loneliness, like the meal delivery programs, for example. Programs that were simple and fun encouraged participation. Agencies continued to see ongoing needs that needed to be met around skills, interest, and access to technology. Best practices included clear, consistent, and repetitive messaging to remind community members that they were still open for business. They're still here, even though a lot of other businesses may be closed. Also, stakeholder input and community collaboration were very important for successful program efforts. Agencies indicated that continued evaluation of the effectiveness and participant satisfaction of programming will help inform their program decisions moving forward. Results from the partner survey were disseminated in a webinar format with survey evaluation at the end. There were 66 participants on the webinar, with 13 responding to our end of webinar survey evaluation. And we had 100% of those participants learn new information on the topic, so that's exciting. 92% agreed or strongly agreed that they will use the information that they learned. And then when we asked one action they would take as a result, 10 of the 13 responded, and 50% of them indicated they would be reaching out to community partners to discuss social isolation and loneliness and how they can address it in their own communities. Our report had 354 page views, so we know that partners have been viewing it. A follow-up interview with key stakeholders identified by extension educators throughout the state or community partners would help our team determine how the survey results are being used and how this information could be used in the future. And we were currently surveying partners on the usefulness of the report and how they use that information.
So no good extension program would happen if we didn't take time to reflect on what we learned, how things went, and what we might do differently next time. So I just wanted to share a few of the lessons we learned along the way with our COVID-19 Extension Rapid Response Team. Sara and I already shared the evaluations and impacts of the 3 products that our team produced, the resource guide, the decision guide, and then the partner survey followed by the report. But what did we actually learn about the rapid response process? We know from our experience that a small group with connections to a variety of additional networks to seek input was really important. So our group, including our grad students, was about half a dozen people. So we were able to meet frequently because we weren't trying to bring a dozen or 2 dozen people together. So we had a small group, but the group was strategically selected based on where we were located in the state and what other networks and connections that we had professionally. We started with very specific and agreed on goals that were supported by administration. We didn't shoot for the stars. We were really, really focused on what we thought would be able to be manageable, doable, and that we'd have our deliverables in a short amount of time. We had an appreciation for the time commitment and the availability to commit the time. So when each of us said, sure, sign me up, we knew what the expectations were for time, and we really stuck to that and respected each other's commitments to that process. Like on any high functioning team, we really made good use of the skills and connections of the individual members. We were all great at delegating when needed and following through on every single project. We had to be flexible from start to present day. I wouldn't say finish, but we had to be flexible start to now because COVID-19 kept evolving. We'd have something almost ready to go and then there would be new information or a new resource or a new way of looking at things. So we had to be really flexible and our responses had to be flexible. As tried and true extension educators, we had to think about the goals and the evaluation plan early in the process so that we'd be ready to find out what the impact was as those products were released. So we did value our connection to our evaluation specialist. We did take time to pilot, and our focus groups told us we could have even done a better job with our pilots. But taking time to pilot was critical, even when there was a tight project timeline. We were very responsive to the pilot feedback and very clear that if you can't do it, don't ask about it. So we were constantly editing our flowcharts and our worksheets and our tools as we went along. Our timeline was really tight. The team meetings were frequent. We were meeting at least twice a week, but usually only for 30 minutes at a time, just doing a status update, what the next need is and what's coming up in the future. We had a very focused agenda where we shared our assignments, results, and feedback on a product, and then agreed on our next steps and who would do what. And we were pretty conscientious about tracking what worked and what the wrinkles were along the way. And that was to hopefully benefit ourselves and for all team members for the next time we are called on to do something like this. Sarah, I'll turn it back to you.
All right, and I'm going to share our resources here. We are going to do one more poll in the chat. So if you were listening today and thought, "Ooh, I'm going to use that," or "I'm going to take this back to my work and see how we can adapt this to respond to similar needs in the community," share with us in the chat just one takeaway from today's presentation. And once I stop screen sharing, I'll be able to post our resources in the chat, and these resources are linked to our decision guide and our partner survey report. And so now that we've had these tools out for over a year now, they have informed other organizations that either in the state or nationally to use the decision guide and adapt that for some of the audiences they're with. And then our DHS, our Wisconsin Department of Health Services, is actually going to use some tips on how we did our data jams in some upcoming projects that they have for partner surveys. So that's kind of exciting that our work was also informed by our partners, but we have helped inform other partners moving forward in how to address social isolation and loneliness, or even just decision making. So we'll see what's in the chat here. I like the idea of checking in on others in the community to see that they're using the resource guide. Yep, I'll post the links in the chat. Yeah, the decision guide, I think even though there might be light at the end of the tunnel, there's definitely still use for the decision guide. And as Ruth mentioned, we were continuing to update that. When the vaccination was available, we did update that to include information about the vaccine, and that even though there was a vaccination available, it's still important to take those safety measures and really make informed decisions around gathering with other people or going to events and things like that. So, okay, it looks like the decision guide is a big hit in the chat today. So I'm actually going to stop sharing my screen. And I want to thank all of you for joining us today. We're really excited to share our work with you. And I think I'll open it up for any questions that people might have, and I'll share these links in the chat.
This is Teresa from Kansas.
Hi, Teresa.
Hi. Just recently, our Adult Development and Aging Program Focus Team decided to develop a resource guide. Our local Department on Aging hadn't updated theirs since 2014. So I don't know, did something like that exist in the past for you guys, or was that something totally new that you developed? And if it did, how did you work off some of the ideas that they already had, but then again, adding some new aspects to it as well?
Sarah, do you want to start with that one?
That was the resource guide, correct?
Yes.
Yeah, so I think in some communities, there are resource guides our aging units put out, but our resource guide was really, I mean, we did take pieces from other guides, but it was really geared towards the resources for people to address social isolation and loneliness. So they were very specific resources. It wasn't just a general guide. And I think we wanted to start with that. It was sort of low-hanging fruit to help our educators build capacity in their work and even build some partnerships and let partnering organizations know that we're still here. We want to help our community members get, in touch with resources. And so that was one way that we were able to work in our communities.
Yeah, I think another strength of that resource guide is because it was designed as a template, And we really stress that with our colleagues, like, don't just hit send, don't just forward this. We had CDC guidance there, we had state health department guidance there, but we left the blanks for the local connections. And I think that's what made it much more relevant, so that you could start where you were comfortable, or maybe where you already had connections or familiarity, but you could work your way up to other layers too.
Yeah, I love the idea of opportunities to socialize as a category.
Other questions or comments on our work?
All right. I think we'll hang out for a few more minutes if people have any specific questions and they're not comfortable asking right now. Kevin, you can end the recording.